Hello, my name is Precious. Me and my lab partners, Essay and Nia, will be explaining to you about Klinfelters syndrome. Klinefelter's is a chromosomal condition that affects boys and men. It's the presence of an extra X chromosome in a cell. It makes men and boys appear taller. It makes them infertile. They also typically have small testes, which makes them produce a reduced amount of testosterone. They also normally have abnormal fusion of certain bones, especially in their forearms, curved pinkies, and flat feet. Some major characteristics are reduced muscle strength, tall stature, delayed puberty, less facial and body hair, broader shoulders, enlarged breasts, small testicles, and weak bones. Also increased belly fat. In 1942, Dr. Harry Klinefelter and his colleagues, they discovered that with Klinefelters, there is an extra X chromosome instead of the usual XY. To diagnose this disorder, you can normally use a karyotype. Also, it can be diagnosed with amniocentesis before birth.
Klinfelter syndrome is caused by non-disjunction, usually during the formation of reproductive cells through meiosis. Non-disjunction is when homologous chromosomes or sister chromatids fail to separate properly, which leads to an abnormal distribution of chromosomes in daughter nuclei. Specifically, in Klinefelter syndrome, there is an extra copy of the X chromosome, resulting in a total of 47 chromosomes instead of the usual 46. This extra copy of genes alters the male sexual development. It is important to note that Klinefelter syndrome is not inherited, but rather a random and spontaneous mishap in cell division, as can be seen by the diagram on the left. This condition occurs in approximately 1 in 500 to 1,000 males, and there is an estimated 3,000 affected boys born each year in the U.S. Some other phenotypic symptoms that are not as obvious are the mental and behavioral characteristics of Klinefelter syndrome. Affected individuals may have cognitive defects and learning disabilities. They may experience depression and have difficulty with expressions. They can be shy or have low energy levels. They also may have a reduced sex drive and are normally infertile. To test for Klinefelter syndrome, individuals may get hormone testing or a chromosome analysis.
There is no way to repair the sex chromosome changes due to Klinefelter syndrome. Treatments can only minimize its effects. It's usually to help with symptoms and to prevent complications in the long term. The treatments for Klinefelter syndrome may include testosterone replacement therapy. This is important where levels of testosterone are low. It can be given in a number of ways, but it's usually by gel, which is rubbed into the skin every day, or by injection. This therapy helps to improve testosterone levels in order to aid muscle development, facial and body hair, growth, and sex drive. This treatment also helps to improve self-esteem in males. But note that this therapy does not result in enlargement or improvement of infertility. Other treatments include the breast tissue removal. In males who develop enlarged breasts, excess breast tissues can be removed through plastic surgery, leaving a normal-looking breast. Another way is the speech and physical therapy. This treatment can help boys with Klinfelter syndrome overcome problems with speech, language, and muscle weakness. Another one is educational evaluation and support. Boys with Klinfelter syndrome have trouble learning and socializing and can benefit with an extra assistance. Talk to the teachers, the child's teacher in school and counselor, and as well as the school nurse about the support. The fertility treatment is another one, and this is because most men with Klinefelter syndrome are unable to father kids. So, because they have the low sperm and which is produced in the testicles, this man go through a procedure called the ICSI, which is the intracytoplasmic sperm injection, where the sperm is removed by biopsy needle and injected directly into the egg, so as to help them have kids with their partners. Another way is the psychological counseling. Having Klinefelter syndrome can be challenging, especially during puberty and young adulthood. For men with conditions, coping with infertility can be difficult. So it's usually good to have a family therapist or counselor around to help them go through with this. There are other names for these conditions. As you can see, there is the 47XXY syndrome, there is the KS, which stands for Klinefelter syndrome, and there is the XXY trisomy. There are other variations with this syndrome, where the X chromosome it's more than just 47. It is the XXXY, which is it's 48, and there's the XXXXY, which is 49, and it's usually, these variations are usually not common, they're rare. The inheritance risk, just like my lab partner earlier mentioned, she already mentioned that it's not inherited. In vast majority of boys, there is no other person in the family which is affected, and it's usually thought that older parents are more likely to have children with Klinefelter syndrome, and this is probably because the risk of this chromosomal abnormality increases with age. Thank you for listening, and that will be all. Bye bye.